I know is watching.
All right, we are live. Hello, everyone. My name is Marjorie Vail. I am co-director of awareness at Push for Empowered Pregnancy. I haven't done it live in a long, long time, but I'm excited to be here today with Gavin Murray, who is a Utah community chair for the National CMV. So, Gavin, welcome.
Hey, thanks for having me. I'm super happy to be here.
We're happy to have you. Now, CMV, I'm going to try and say it. I've been practicing, so I'm going to say it once as Sam stated, and then I'm going to go right to CMV. So it's cytomegalovirus, right?
Perfect. Yep, killed it.
Perfect. Okay, awesome. So we're here to talk about CMV awareness. We found out that June is CMV awareness. So I know many people are watching and they're like, if especially if you haven't been pregnant and haven't, had a child, you may not know what CMV is. Personally, I've had two children and I don't know what CMV is. So we are so excited that you get to educate us and definitely save some lives. So
Yeah.
tell us about you and tell us about CMV.
Yeah. Well, I guess starters kind of going off what you're saying there. Um, as a fact, about 91% of people in general don't really have never heard of CMV.
Hmm.
So that's one big reason why we're trying to push it onto the public because it's detrimental. It can result in pregnancy loss. That's why we're here, right? Because there's the
Right.
overlap between CMV and push. So it can result in pregnancy loss, childhood death, blindness, deafness, severe motor delays, um, and so it's quite a broad spectrum. About 1 in 200 births result in, or sorry, about 1 in 200 children who are born have CMV, and
Mm.
about 1 to 5. I've seen different numbers for this next one. 1 to 5, 1 out of 5, or 1 out of 4 kids will have a permanent disability from it.
Oh
And
wow.
so if you're one of those 5 or 4, it can be pretty severe, but it's also, there are plenty of cases where it's not as severe. So um, the sad part is, like I was saying just before, if you don't know about it and all of a sudden it comes out of nowhere and blindsides you, it's traumatic, right? So
Right.
that's why we want to definitely spread the word and let people know how to take action to prevent it. Unfortunately, it's, if you're an adult, you might not even know you have it. You can
Mhm.
be asymptomatic because your immune system's so strong, so you don't think much of it. But then all of a sudden, if you get it while you're pregnant and you pass it to your kid, that's what the word congenital means. If the
Right.
fetus gets it while you're pregnant, right? Um, then it can cause the really big side effects that we were just talking about. Um, the only things you can really do to prevent it are simple things like not exchanging bodily fluids with other people,
Hmm.
uh, like saliva. So no sharing food, no sharing utensils. If you got a toddler is actually the biggest risk factor you can have to get the virus. So
Mhm.
if you like, they drop their binky and you try to like suck it off to get the dirt off, right? That's a
Right.
big no no. After you change their diapers, wash your hands super well. Small things like that. But that said, like even if you're doing your best there, it could just happen that you end up getting it. And so there's not much to be done, which is why I'm super passionate about involving myself with National CMV Foundation to advocate, push for a vaccine. Yeah, fun fact: Moderna, before
Mhm.
they came out with the before COVID happened, they were super close to coming out with a vaccine for CMV, but then obviously the pandemic hit and they switched
Right.
everything. And
They got
so
sidetracked.
exactly.
Got
Um,
it.
I hear. Oh, sorry. What was that, Marjorie?
No, I was go ahead. I got my
Oh,
questions ready.
okay. I was gonna say, Moderna, I hear they're pretty close to coming out. I don't know where exactly they're at with the trials, but they're pretty close to the vaccine again for CMV. So we're crossing our fingers, hopeful that it turns out well.
Right. Yeah. Let's cross our fingers with that. Well, they came out with a vaccine for COVID quickly, so we
Yeah,
can there's lots of hope. So how does one know that they may have CMV? Like, what are some of the symptoms that can alert someone that something's wrong here?
yeah.
Does it look different for non-pregnant people and pregnant people?
That's a great question. I'm not an expert with this exactly. From
Mhm.
what I've gathered when I've looked through the National CMV website and from other readings that I've done, Like I said, it could be asymptomatic. A person could not show anything, just because for an adult, for a fully grown person, it's really doesn't have that much of an effect from what I've read.
Mhm.
My wife, for example, when she's at some point in her life had CMV, I mean, she didn't really notice much.
Mm.
We didn't ever like throughout her pregnancy, we'd never have a time where it's like, oh my goodness, we need to take you into the hospital. You're so sick. Um, so yeah, that's the biggest downside of it. It just kind of comes out of nowhere, and you're not sure when you're hit with it.
Hmm. So if someone, which is a little bit scary, right? Especially for
Yeah,
like someone who is, it's it's one thing if you're like an average person who's not pregnant, who's not, about to give birth, but then it's another thing to be pregnant and to think that you have something that can be passed on to your child.
yeah,
And so what I think I hear you saying is that CMV is definitely something that you can pass on to your baby.
definitely through the placenta, you can absolutely give it to your kid. And something about CMV also is that it's part of the herpes virus family, and so it lies dormant
Mhm.
and can reactivate. And so, um, if you do have it before you're pregnant, if you become severely stressed and it flares up, the virus flares up again, and you have like a recurrent infection, you can pass it to your kid again. So,
Mm. Oh
so I
wow.
say that it's weird though. From what I've read, the studies that I've read, there's not an increased risk of giving CMV to your future children after you've given it to one. So
Mm.
even though it may sound contradictory to what I just said, it's from what I've read, it's not an increased risk if you have future children.
Got it.
Yeah.
So, what can a pregnant person do, right? Like, you may not know. I don't know I have CMV. Is there something like, is there testing that pregnant women can do to find out? And then what happens after she finds out that she has CMV?
Great questions. And so I think what you're getting at, it really highlights the necessity to have early screening. And that's a big thing that National CMV Foundation does. Here in Utah, we have great legislation and screenings are pretty much common if there's any indications for CMV. Other states, not so much, which is why we're trying to really, really push it. Anyways, but to directly answer your question,
No, it's important. What you're saying is important.
to directly answer it, what happens if you are pregnant and you find out? Again, from what I've read, I haven't heard firsthand accounts of this, but from what I've read in the literature, um, a pregnant woman can take doses of an antiviral medication, and that would be able to be passed down to the fetus through the placenta. And then if the baby is born with the CMV, you can put them on antivirals. Like my son, for example, took valganciclovir for 6 months of his life, and we don't know an alternative like reality where he hasn't taken it, but
Mhm.
he's doing super well. So maybe it's attributed to completely that, right?
Mhm.
So um, yeah. So antiviral pretty much is the only thing that you can do once they've already been born with it.
Got it.
Yep.
So it sounds like that it's not specifically part of standard of care for a pregnant woman to be tested for CMV. Do I have that correct?
Um,
Well,
I don't want to answer one way
maybe
because
from New
maybe
York. I
yeah.
don't know about Utah. Let's just talk about Utah because I
If
don't think in New York it's standard. I think you would have to ask for it. But what is it for Utah?
Yeah, it's unfortunate because so National CMV Foundation, I know we do have roots in New York. Like there should be screenings and stuff, but it's so spotty because maybe stuff was passed, like legislation was passed, but then some people are implementing it and not others. And so, like you said, you feel like you haven't felt that in New York during
Mm.
your pregnancies. Some people in Utah haven't either, but some healthcare providers are on top of the ball and they know that it should be tested for. But again, maybe I'm not the best person to ask that question to,
Right.
but I would say it's probably not standard throughout the pregnancy to test for
Hmm.
it, because we didn't experience that either.
Okay, got it. And so, what is it safe to say that you're advocating for pregnant women to ask? It doesn't hurt to ask, right? Or like, and do you know what the testing is like? Is it like a blood test? Is it a I don't know what kind of testing? So many types of testing.
Yeah, no, I absolutely do think that it'd be wise for everybody who's pregnant, every woman who's pregnant to ask their physician to be tested for it. And yeah, when my wife was tested, it was a blood test.
Okay.
They just check like your antibodies and stuff.
Hmm. And again, I think I kind of missed like what is the effect it has on a child who is born with CMV through its mother.
Yeah. So if you're born with congenital cytomegalovirus, the symptoms are typically hearing loss, loss of vision. It
Mm.
could be, and again, this, like I said earlier, it's a spectrum. So maybe some kids have it, some kids don't. Um, Severe motor delays, like you could be really delayed in walking. I don't know if I mentioned it earlier, but talking too, that's a pretty
Mm-mm.
common one. So if you have a CMV, a congenital CMV child, severely affected by it, it's not uncommon to see them in maybe wheelchairs or have cochlear implants. Um, yeah, so it could be pretty devastating. But
Mm.
the important thing is, and something I've really grown to appreciate about the National CMV Foundation as I've been involved, is that there's so much joy in just coming to accept the diagnosis and continue to love your kid, like in spite of it,
Mhm,
With
mhm.
it.
Yeah.
So so yeah.
Yeah. Well, it is awareness is key, and I think with everything, with us at Push, our goal is to raise awareness for stillbirth, and there's so many things, as you were saying in the beginning, that can be connected with that can lead to things like stillbirth, and being aware of like viruses like this is so important because honestly, we're when we get pregnant, we're so happy and we're so joyous and we're so ready to like for the journey. But in the journey, there are like lots of bumps and so we're so unaware. Like I said, I think while we were offline, I was telling you I had my first child, the one that was stillborn, um 20 years ago. And I wasn't thinking about CMV like that, would have never, come across my mind. And so I'm so grateful for people like you and the CMV, foundations that are, raising those awareness so that when people are pregnant and they go in, it's not to be afraid, but just to have an awareness so that they can just be asking the right questions and going for the right testing. So those things are very, very important. So thank you so much for what you do.
Oh,
Um, and it
thank you.
sounds like I was going to ask you why you got involved, but it sounds like it's a personal thing. So you
Yeah,
tell us a little bit more about that.
totally. I just want to say first off, I'm sorry to hear about your loss,
Oh,
and
thank you.
likewise, I'm extremely appreciative of what you're doing because everybody needs to know what you're talking about too.
Yes, thank you.
But why I got involved? So, um, my son, he was born with CMV,
Mhm.
and it was an unfortunate. It was awful news to get because the nurse, I remember vividly, came into the room. So my son was born with a small head, and microcephaly is one of the biggest indicators of CMV. That's why they came in that night, took a urine sample, and the nurse was like, "Don't worry, never comes back positive. You have nothing to worry about." And
Mm.
so they
Oh,
leave, come back, and then she says, "Yeah, so it came back positive, but don't look
no.
anything up. Don't look anything up. The doctor's gonna come talk to you. Like, don't scare yourself." And so we're thinking, like, is he gonna die? Like, what does that mean when
Right.
don't look anything up? Uh, so it was traumatic there.
Yeah.
When we finally talked to an expert on it, we kind of understood the situation more. And yeah, it presents its own challenges, but we've lived with him. And our son Xander is his name. He's amazing. He's super happy all the time, and we're extremely blessed with him. Um, but what really propelled me to dive into like looking at what there is to do is when we were discussing, like when my wife and I were discussing having another child, and
Mhm.
I saw how much it affected her thinking of maybe passing it on to another
Mm.
child of ours.
Right.
We had known about how it lies dormant and it can flare up, and so we're thinking, like, is it more likely that we're gonna have another kid with it? And so that's when I kind of just went crazy looking up stuff, and I read everything on the National CMV website. And after that, it brought a lot of comfort because I learned about how it doesn't have an increased risk. But then as I was looking through stuff, I just saw like, oh, volunteer and like you can do this. I'm like, I need to do that. I need
Right.
to
Right.
help other people know about this. So that's kind of like my take on it. how I
And
got
so, good, thank you for sharing. And as an ambassador, like, what is like your role? Because
great
you're the
question.
chairman, right? Aren't you the chairman?
I so the community chair, that's like my title, but I'm just like a
Okay.
local advocate. I'm here to do what I can, humble servant. Uh, what I do typically, so like I was mentioning earlier, Utah is ahead of the ball. They're just doing great with having screenings in place, and so legislation is there. It's just about spreading the word. And so I tried to engage, like I've reached out to multiple pregnancy classes, trying to share what we do with people who would it would most likely impact, right? Um, and then also because I'm so passionate about getting a vaccine for CMV, I am really, really keen on the fundraising part. So I'll just put a quick plug out there for you guys. This Saturday, June
Uh-huh.
29th, we're gonna have a 5K fundraiser in Provo, in Utah area, if you're in the
Mhm.
area.
In the
You're
area.
gonna- yeah, if you're not in the area, there's a virtual fundraiser.
Awesome, awesome.
Yeah, so if you want to like do a 5K, just walk 3 miles wherever you're at and donate. It's same thing. It's going to the same cause. Um, but yeah, so I'm really hip on the vaccine or fundraising so we can get a vaccine, because if you've ever heard of another virus, rubella, it was detrimental. Yeah, you've heard of it.
Hmm.
So it is similar to CMV, where it's most detrimental when you get it congenitally. But
Mm,
because we have a vaccine that people are standardly given now, it's not really a thing anymore because
right.
you can correct if yeah. So hopefully,
Yeah.
same thing happens with CMV.
Well, you're right, because I think you can't even go to school if you don't have the rubella shot. That's
Yeah,
one of the series of shots that you know parents have to do if to get their children into school. So
yeah,
um it'd be interesting or beneficial to have that CMV a CMV vaccine be part of like something to be part of the lineup, I guess.
I
You know,
know.
I know there are definitely some people who are anti-vaccines.
Yeah, take it with a grain of salt, but
Yeah, yeah, but it's important. I think what's the scary part of it is just the not knowing that you can have the virus and not know, and not know where you got it from, not know that you have it,
yeah,
and then on top of that, passing 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 it on to your child.
yeah,
um and there could be a lot to that. If you don't mind sharing, like, and I you're not your wife is not here, so you can only speak secondhand, but how was it like for her to find out that she had it, and then was passed on to her son? Like, what was her lived experience with that, like?
yeah. I don't want to put words in your mouth, so obviously, like you just said, it's completely secondhand.
Mm-hmm.
But I mean, I was there, and it was, I mean, it was devastating. Like I said, we thought maybe our son was going to die,
Mm-hmm.
and it brought her to tears, and I was extremely emotional as well. But anytime we heavily consider it and think about it again, like it was pretty traumatic, and it's sad thinking about how this such a small thing will have such a big impact on his whole life. Because even though Xander's doing so well, like he has delays that will probably stick with him the rest of his life. And we were speaking with my wife took him to see his neurologist, and he was saying like, yeah, maybe he's probably not going to be the best with math, and like you're just gonna have to understand that. And so you just know there's going to be delays later in life. And anytime my wife and I talk about it, it's pretty upsetting. It's really upsetting. I don't know why I'm watering it down, but yeah,
No, I mean, we can us at Push, because we're founded by all lost all lost moms, all lost families, and there's no watering it down. I mean, sometimes you have no words to say to describe the feeling of feeling like, as a parent, like, I feel like as soon as you know that you're pregnant, you're just like, you feel responsible,
yeah,
and then to get to that end and to have a child either pass away or to have a child get sick, unwell, you feel responsible, and
yeah,
so and I think it bodes to why, and hopefully it helps people understand why we're so passionate about what we do, why we're so passionate about raising awareness about like all the different ways, to prevent stillbirth, or the different ways to prevent CMV. It's like, and people are sometimes are not uh really aware or care, or people don't care unless it's happened to them,
Yeah,
or unless it's happened in their family, right? And we want people to know that you don't have to wait, for that to happen. We want to prevent you from dealing with trauma. So
exactly.
I think awareness is definitely key. And we just, thank you again for being here, and just spreading that awareness for the people who are watching who may not know. It's really important. So earlier you talked a little bit about legislation. Tell us what happened in Utah, and how can we get it to happen in the other states, because that's important as well.
Oh man, that is a great question. There have been people before me who had the bigger hand in that. I
Hmm.
really have walked in this beginning of this year and started with the National CMV Foundation. So I'm not the best resource, I guess, to talk about what exactly needs to be done. But I know there's coordination with local like politicians, and you have to reach out to the hospitals, and I know exactly who you should talk to. That like if we could loop them in, they would be the best resource to talk to about that. But
And who would that be?
Stephanie McVicker, she is a big wig for the state of Utah as far as getting legislation, and she knows CMV in and out. So
Hmm. Hmm. Okay, perfect. One more
yeah,
time, what's her name?
Stephanie McVicker,
McVicker. Okay.
and McVicker is McVicar.
Okay.
Yeah.
And so what was the legislation that was passed in Utah in terms of CMV?
Just
You
that,
have to be tested, or like what is it?
to my knowledge, it's if you have any symptoms when they're born, that they need to have a screening for it.
Oh, okay.
Yeah.
Okay. Otherwise it wouldn't be.
To my knowledge, yeah, that's how it
Okay.
would be.
Okay. All right. I'm not too sure. I know that when I went to the National CMV Foundation website, I
Yeah.
saw that we have an ambassador. There's a Brandy and Akara, and so I just want to be able to. I want to encourage anyone who's watching, if you're interested in wanting to know more, definitely need to go on the National CMV Foundation website, and there's definitely lots of information there, so that if you're curious, or you want to donate, or you want to support, that's the place to go to be able to do that. um, is there anything else that we need to know about CMV? Oh, well, you say you have a fundraiser happening this
Yeah.
weekend, right? Anything coming up on the horizon for the CMV Foundation?
On the horizon, not that I'm aware of. It's a pretty like I'm pretty focused on what's happening here in Utah.
Hmm.
So each state is a little bit different as far as which community chairs doing there. But organization as a whole, nationally, I can't think of anything off the top of my head.
Okay.
We're just 24/7. Let's go battle CMV. So if you want more information, just hit up National CMV Foundation website.
Hmm. And in your role, are you like someone, do you like conduct meetings? Is there like a support group for families that have CMV, or things like that, or you know change maker, we call them change maker, but volunteerism, like things like that?
Cool. We definitely do. Like if there's ever a baby that's diagnosed with CMV, we try to reach out to the parents and get them connected with support groups. Yeah.
Hmm.
There are things that like Eddie, so we try to reach them or connect them with Eddie within the state. Um, and yeah, sometimes it's super personal, and so they don't really want to talk about it, which is okay. So we just give them space in that case. Um, but yeah, we try
Yeah,
to do our best to make sure they feel a community around them.
absolutely. We have one person who's thanking you for sharing, your story, and also to share about CMV, so that our community can know and understand what to look for out for themselves and for their families as well.
That's very
Um,
kind. I appreciate that.
yes. Um, I feel like I had like something going, like a question that popped into my head, and then it just like ran out of my head right
Oh, that's
out.
the worst. It's on the tip of your tongue.
This is what this is what happens when you don't have coffee. You just like I'm doing this interview like minus my
It
minus
happens.
my coffee. But no, I remember now. It wasn't a question, it was a statement. I just want to commend you and your wife for sharing your story, because as a mental health counselor, sometimes there's a sense of shame that comes with things like that, like things like CMV. Even with stillbirth, people can feel like some shame and feeling like guilt or whatever.
Yeah.
But it's in sharing the stories that that we raise awareness, and that people will know and understand what to look out for themselves, and like I said, for their family. So thank you so much for putting your story out there. I just want to commend you and your wife for being able to do that, and being able to push the fight forward for the future, for future families, so that they don't have to go through what you're going through right now. So thank you for
Yeah.
that.
I appreciate that. Those are super kind words. I wish my wife were here because she's much better at storytelling, and she'll be the first to say I'm not the best at describing stories and stuff. But
Right.
no,
Well, maybe we'll have her on another time.
nice. That'd be awesome. And I think what you're saying is that's what eats at me the most. Like when I see other people feel guilt for something that's
Mhm.
completely out of their control, like
Yeah.
stillbirths and CMV, you cannot control that at all.
Right.
So even though like you're saying it's completely natural to feel that shame or whatever you might feel, it it's just heartbreaking to think that people have to deal with those emotions, even though it's not in their control. They didn't want it.
It is. It is. And I remember, when we had our stillbirth, and like I said, it was 20 years ago. There was no support group. They kind of like put everyone in all losses together, and loss is
Really,
loss, yes, but there's this differentiation between
well,
loss of a baby and a loss of an adult child, a loss, you know what I mean, a loss of a
yeah,
mother. Um, and so I appreciate how in 20 years we've come this far in terms of support for families, and that how distinct it is for parents who've had stillbirth, and so many organizations that are shedding the light on it. And so it gives me so much gratitude for that. But it's needed.
oh, it
It's
totally is.
absolutely needed. you know
Is I was gonna say, so as I reposted this to my story, and my wife and other friends and family did, maybe there's some people in Utah and Idaho that haven't heard of Push. I know that haven't heard of Push. I know I'm pretty naive as to what the organization offers. So I
Mhm.
guess if there are people in Utah and Idaho that aren't as familiar, would you want to take an opportunity to say like what Push can do for people that might be affected in over here? I know
Yeah,
you're in New York, so it's a distance, but
absolutely. So Push for Empowered Pregnancy was started, my gosh, is it like 3 years now? 3 years. We feel like we've been going on for 10 years, but it's been 3 years. Started by eight, nine amazing women, eight present, who experienced loss. And the big thing for us, of course, is to get the latest, learn from the latest research, find the latest standard of care to help support families to know, what's going on with their placenta, know what's going on with their bodies, things like that. Our goal is to reduce preventable stillbirth by 2030. That's the goal. And a lot of what we do branches out into legislation. Like right now, we're fighting for paid family leave, and currently, if someone was eligible for paid family leave, and unfortunately their baby passes away, they're ineligible, right? And so
really,
that means, yes, that means that they have to go back to. I mean, I know I had to go back to work after like 3 days post my pregnancy, and thank God for my employer who mercifully gave me 6 weeks paid. And for
That's
most
awesome.
people, that's what it's like, that they are at the mercy of their employer. Or and it's so funny that the husband can be able to get the paid leave, but the wife who had the loss, well, it's just so
Yeah, that's
complicated.
backwards.
Yeah, very backwards. And so yeah, and the biggest part for us is the equity piece, because uh, Black women specifically, and BIPOC women and families experience it, stillbirth, especially Black women, 3 times more, 3 or 4
Really?
times more than, yeah, than white women. And so for us, that is very important, that we're shedding the light, because um, sometimes, as a Black woman, you can feel unseen, and unheard when you go to, like, the doctors, and you're complaining about stuff and no one's listening to you. It's just like, ugh.
Yeah.
um we also just created a training, uh a pregnancy after loss training as well, that's been very helpful in the medical community, in helping doctors to understand how to support families who've had a loss, right? And they're having another baby. Like, how do
Yeah.
we support them? How do we, from the moment that they step into the office, how do we get them through the 9 months, right? With their sanity, because sometimes you feel like you're going insane. Like, people say stupid things, and you're just kind of like,
Emotions are high.
I just
Say the
want a
least.
live baby. Just give me a live baby. So, so that's the other thing, that we are so proud of ourselves for doing that. Oh, even more like, whenever I think, oh, I'm done. We also was pivotal in partnership in opening the first rainbow clinic in the United States. It's something that is well known in the United Kingdom and Europe, started by Dr. Hazel, and it's in Mount Sinai right now currently, and I think there's one in California with Dr.
Yeah.
Rad, and I think we have one coming up soon, pretty soon too. I think at Columbia University, maybe, not sure, but
Fingers
but
crossed.
so the Rainbow Clinic is, a specific place where parents who've experienced a stillbirth, right, from the moment, like I said, they come in, throughout their pregnancy, they are getting a higher standard of care, right?
Awesome.
Extra tests, extra everything, mental health support that they need to help them to get through, like, the pregnancy. So,
That is
um,
awesome.
yeah, that I feel like that's one of our biggest flex, besides being awesome, badass
Yeah.
mom. You know, I don't usually curse, but I had to
Yeah.
today.
It's suiting what you're saying. I'm curious. That really fascinates me, the Rainbow Clinic, and also the training for the I forget what you called it, but the training for doctors to deal with,
Yeah, the PAL training, pregnancy
okay,
after loss training.
pregnancy
Hmm.
after loss. I thought that
Yeah.
was really cool. But I'm curious with the Rainbow Clinic.
Hmm.
It sounds like there's just a few, like one or two in the US. It sounds pretty obvious. Like, why wouldn't that be a thing? So, what's the biggest barrier to getting them started? Just
Money, money, lack of knowledge, politics, bureaucracy, just a whole bunch of stuff.
hmm.
Um,
I
actually,
figure if clinics
we
pop up
really. Hmm?
I was gonna say, I figure if clinics pop up all over the place anyways, like why not center the next clinic on what you're saying, you know? So I'm curious.
Yeah, no, we absolutely agree. I know with the support, push, and our supporters, our followers, our, you know, funders are the ones who helped us to be able to fund the Rainbow Clinic, and so we're very proud of it, and we're very proud that there is actually one, and we hope that it continues to spread throughout the United States,
Yeah.
so that every state has uh, that safe space, for for families who've experienced stillbirth. So
Yeah.
yeah, so that's what we
Okay.
do. I'm sure we do more, but
No, that's great information. I'm sure a lot of people, I mean, to me that was new, so I'm sure everybody else that was joining with me was
yes,
equally impressed and happy to know that new information.
yes, and we have partners as well. We have Count the Kicks, that we work alongside with. We have Aaliyah in Action, who is more of on the bereavement side. So if we have families who've experienced a stillbirth, Aaliyah in Action with that organization does send care packages for the families. Just to feel like seen, and make them feel seen. And and just to have a little, I think we can't take for granted the importance
Mhm.
of self-care
Yeah,
after a loss. It's every time I talk about it, I relive that moment, like, specifically.
I'm
It's
so
almost like
sorry.
PTSD, even though I don't have PTSD. But, like, I can take myself right back to that day,
Yeah,
and so it's a little bit of a comfort. So,
I'm
um
impressed with how well you're able to talk about it, even though I'm sure, like you're saying, you're reliving it.
yeah, yeah. Well, it's important. It's an important thing, and we're very passionate about it. We're very passionate that we really want every family to go home with their baby. We don't want anyone to have um, an empty crib.
Yeah,
'Cause we know what it's like to live with that, and we don't want that for anyone. So I think that pretty much sums up push. But I got Sam in the back over there. So Sam, if I missed anything, like, please do, like, let me know. But Gavin, I know you have to go. So
yeah.
I want to say thank you so much. And also
Thank
to your
you,
wife, I know her name. Thank you for
Lexi.
sharing your story, and thank you for your ambassadorship, and spreading your knowledge about TMV, and helping to save some babies, and save some people. So thank
Yeah,
you.
that's the goal. Thank you. No, I really appreciate you having me on, and thank you for everything you're doing. Everything you said applies to you.
Yeah, thank you. Well, thank you everyone for watching, and there will be a replay. So if you missed it, you can watch it on our all of our platforms. Bye
Awesome.
everyone.
Sweet. See ya.
See ya.